Hi, my name is Carrie Steindorf. I work at the Rockland County Department of Health. I'm a program specialist and a school health coordinator. So back in 2021, we were, wrapping up the first school year of the COVID-19 pandemic. We were eager to start working on creating healthy schools and communities, and we called it CHSC based on its acronym. So we spoke to our liaison at the school district, who was the PE coordinator. We said, what do you want to spend this money on in year one? The context here is the schools were finishing the first year of that COVID-19 pandemic. He really wanted to get children outside. He really envisioned a new unit in the PE program, which would involve mountain bikes. And this was very new and novel. The school district we were working with is the North Rockland Central School District, which has 8,000 students, half of whom come from low-income families and live in more densely populated areas. Many of these children would not have bikes, would not know how to ride a bike. So introducing a PE unit or physical education program unit on biking was brilliant. The school district had the physical property to develop some simple trails. So they had the space, they just didn't have the bikes and the training for their teachers. So this grant was able to purchase 40 mountain bikes of various sizes, along with helmets and a storage container. The funding also was able to train the physical education teachers in teaching biking skills. And by the end of that first year, children in the middle school and high school were on those bikes and riding. And it was very exciting for the school district. Now, how amazing is it to ride a bike, right? You learn that once you ride a bike, you never forget. So let's get children on a bike, build that competency. These were children who might not ever have a bike, but once you learn to ride a bike, they could then eventually ride a bike maybe to work one day or to their local park and have a skill that is lifelong. We saw an opportunity to buy more bikes for kindergarten students to learn how to bike, and then the upper grades, and then eventually build on a curriculum in the physical education program that would train all 8,000 children to ride a bike. So in the year number 2 of the grant, we were in the school district, we purchased enough bikes for each of the 3 kindergarten through 3rd grade elementary schools so that their PE unit could teach kindergarten and 1st grade students to ride without pedals. And once the children gained enough skill, those pedals would be added on. Our CHSC program in Rockland County involved several partners. The North Rockland Central School District was really central to our program planning, and our other partners that support that school district would be a couple of the surrounding villages and the town itself in which the school district really resides, and the early child care programs that feed into the public schools. So those were our collaborating partners that received funding. And to ensure that we had continuity for this overall program of increasing access to physical activity. So it was in that setting that we developed this idea of the biking program moving into other sectors of the community. So from the school, while we looked at building that physical education program from kindergarten to 12th grade, we also saw that we could bring that biking program into the childcare setting. That led us to realize, hey, we have a community partner that is focusing on the early childhood programs, daycare and preschools. Let's look at purchasing even smaller bikes for those daycare programs for children to scoot around on without any pedals whatsoever, so that 2-year-olds and 3-year-olds and 4-year-olds could develop that balance and familiarity with a bicycle so that when they go into kindergarten, there's that continuity. Little bikes were purchased for the youngest among us. That led us to realize, hey, there are children in the K to 12 program in the public schools that have special needs who might not ever be able to ride a two-wheeled bike, but they need to be able to ride a bike and enjoy biking in their community and in school just like the other students. So we worked with the special needs department, and they selected the bikes they wanted, and we were able to use these funds to purchase a very high quality adapted trikes for their special needs students. My colleagues and I wanted to ensure that this funding not just provided necessary equipment, but built continuity between the school and the community. And the village of West Haverstraw realized they have a summer camp, and they would really love to bring in bicycles for their summer camp, but they didn't have the money to do that, or the space, frankly, for storing those bikes all year round until the summer. And that physical education program stepped forward and said, hey, let us lend you those bikes for the summer. The same children would be learning and practicing their biking skills in the summer months. The village then realized, oh, this was an opportunity for them to use some funding to buy a bike fix-it station for their very popular park called Peck's Pond. And so that's already bike friendly, but how fun is this that somebody could learn how to change a tire or pump their tire or fix something that their chain came off, and learn how to use a bike fix-it station. So the students were learning how to use this tool, this stationary tool in their park, and then any of the local bike riders could use that fix-it station as well. So this really has grown into a much bigger point of connection. The village of Haverstraw and the village of West Haverstraw have now complete street policies that are examining their bike routes and are actually going to be making some changes in their downtown street design to include bike lanes toward additional transit hubs. I think a real standout success of the Rockland County CHSC program has been this collaboration on a biking program. It started as a simple strategy to get children more physically active, particularly at the secondary level, but really then became a comprehensive physical education program within the school district, extending into our early childhood programs, extending into our parks and into our street design, so that kids who learn how to ride a bike in school can then actually use their bike to ride into the center of their village and go to their park or go to a library program or use that bike as a form of transportation and be able to do it safely in streets that were designed to accommodate bikes. We now have the village of West Haverstraw and the village of Haverstraw with complete street policies that included attention to bike lanes and bike safety and pedestrian safety. And that is huge, to redesign a community to make it more walkable. When thinking back on the last 5 years, we see that this is really a legacy to collaboration, to partnering, to connecting people's ideas and resources. The Rockland County Department of Health had many staff members working on this grant because of their expertise that they brought to the conversation. We had half a dozen community partners who were thinking about how they could collaborate and share resources. So this really is a visible testament to the beauty of collaboration, of community, of sharing ideas and resources and building relationships. It's those relationships that will sustain the programming, that we were able to successfully implement over the last 5 years. But how does it get sustained? That's because people will value it and they'll work together to keep it together. And this is a gift to our community, our students, and our families who live in the North Rockland area, who pass through these villages and communities, to provide them with opportunity for healthy lifestyle through physical activity. We're very excited and proud of the work of the Creating Healthy Schools and Communities grant here in Rockland County. We're delighted that this biking program, which started as an idea for physical education for children, has expanded beyond that into the community in a huge way.